Hi everybody, long time no see. I know I've been so busy. I don't know if you guys remember me telling you, but I did enroll in school last month, well the month before last, and I started school on September the 10th. And so I've been going strong ever since. I'm going to school full time, and I'm going to go on ahead and get my degree in education. I have 18 months left thanks to my credits that I got added that I brought with me from my previous school. So that's where I have been. I have been super busy with school because it's each class is 5 weeks, and so they cram. If you've been to college, you know that a semester is 4 months, and so usually have multiple classes that, you know, extend the entire 4 months in a semester. Well, the school that I'm going to, you can take one class every 5 weeks. So they cram 4 months of work into 5 weeks, which can be extremely difficult if you are not organized. But I am organized, so I am doing well. I currently have an A in the class. So I'm almost done with. We're on week 4 of this particular class that I'm doing right now, and so I'm almost done with my very first class since going back to school, and so I'm really excited. Now, welcome to cycle 26. Yes, I know, but I'm looking on the brighter side of things lately. Alright, let me tell you a little bit about last cycle. Now, AF came exactly on cycle 28. Thank goodness. As you guys know, I was taking a break from taking a lot of vitamins and supplements, and it messed me up a little bit because there are some types of vitamins that I do need in order for my cycles to be regular. And so unfortunately, I ended up having AF come a period, 2 periods in a month. It was in the span of 16 days. I had a period within 2 periods between 16 days. You guys, I can't talk. And so that kind of freaked me out. And so I ran and I got some prenatal vitamins, and I started taking these once a day, and I got Geritol Complete, which is a popular multivitamin, and it worked really well, balancing out my hormones, and my cycle came on time like it was supposed to. Fortunately, no BFP, but you know, we're looking on the bright side of things. I'm pretty sure that there's a deeper issue with, I honestly think that my tubes are blocked, to be quite honest with you. And aside from that, I also believe that it's something deeper because I had surgery when I was 19 years old. I had laser surgery on my cervix, and so I don't know if there's scar tissue or anything like that, and so I'm waiting to go to the doctor so that I can find out exactly if I have leftover scar tissue that's blocking my tubes, or my tubes are blocked, or whatever the case may be. And so that is just something that, you know, is a big mystery to me until I see a physician. And so today we are on cycle day 7. AF lasted approximately 5 days. It seemed longer than that, but it was 5 days. And AF left on Monday, which was cycle day 5, and I resumed. I'm working out and everything, still working out daily. I only worked out twice last week because I was just a big cramping, crying mess because I was so frustrated. But I'm in better spirits, you know, now that AF has left and the blues have gone. I'm feeling really good. I went jogging yesterday, and you know, I just feel really good. So now I know I have been saying forever and ever that I've been going to the doctor. Now the issue that I've been having is with insurance, which is what I'm going to talk about now. Now we've been having some issues with insurance companies quoting us one price And I guess when they look at our medical records, and the only pre-existing condition that I have is overweightness, they jack up the price, you know, ridiculously because of, you know, my weight. And so, and probably because I'm a woman too. So, we just decided we weren't going to pay $800+ a month, which is more than our rent, in health insurance. And then they don't cover jack. You feel what I'm saying? They don't cover, I can only get like a pap smear or just like a normal physical. I can't talk about, if I want maternity care or prenatal care, that's going to cost me an extra $200. The devil is a lie. Now that I said the cat, I ain't paying that. So, I was so happy when I heard about the Affordable Health Care Act that was passed, that is now available to us, aka Obamacare, which I don't like to call it Obamacare because I feel like people say Obamacare to be disrespectful to the president, and it is not Obamacare, even though he's the one that signed it into, well, it's kind of the Supreme Court care because they're the ones that made the law constitutional. They determined that the law was constitutional, so they signed it into office, so it should be Supreme Court care. But anyway, I digress, as usual. And so I wanted to know, I've heard so many things about it. I read the entire transcript online, which was full of really difficult and hard vernacular that I just, you know, it's hard to read documents like that are really official, and it's not clear. It's clear to some people who have expertise reading that type of material, but not to the average Joe, the everyday type folk. So, husband and I, yesterday, we decided to go to our local library, which held a workshop on the Affordable Health Care Act and what the insurance is and what it all covers. And this is what I'm reading from. This is what they gave us. And so, I am going to tell you, for those of you who don't know what it is and just curious to know what it all covers, it covers so much. Like, I'm so excited. I can't wait till January 1st I can go see somebody. So, with this new Affordable Health Care Act, if you already have insurance, it pretty much covers more preventative care. You get diabetes and cholesterol screenings, prostate exams, mammograms, and even flu shots are all covered, you know. And so if you have children, your kid could stay on your insurance plan until they're 26 years of age, even if they get married and even if they move out of your house, they can still stay on your plan. I wish I would have known that, but I didn't get married till I was 30, so that didn't apply to me. Anyway, if you don't have health insurance, started October 1st, there's a new, easier way to shop for health care plans in your state. And so what you can do is you can go online and you can access something called the Health Insurance Marketplace, where you can put in your information as far as your demographics, where you live, some personal information, and the marketplace will steer you into the plan that is best suitable for you and your family. So all the plans cover essentials. These include doctor visits, emergency care, hospital care, prescription drug coverage, and preventative care, and more. Now, financial help is available. If you can't afford the premiums, you know, what you can do, if you buy your plan through the marketplace, you can get help covering the cost. For example, a family of 4 earning less than $94,000 a year may be able to get financial help. Low cost or free plans are also available depending on your income. And so what you can do, if you need help, you know, just ask, and they do have representatives that will help you and explain exactly what, based on your personal information, what you qualify for. Now, what I thought was really interesting, of course, since we are in this TTC community, child, and we all know that we need, you know, we will eventually get pregnant, go through that whole prenatal process, and need to spend time in the hospital and all that. So my whole thing, I really couldn't care about myself, you know, other than how to get pregnant, but I wanted to know what the maternity care, what did they offer maternity care wise. So what they offer, the new law classifies prenatal care as preventative care that must be provided at no extra cost, which is awesome since you do have to go to the doctor once a month, and when you get further along in your pregnancy, you have to go bi-weekly or weekly. So that is awesome. No cost. You don't have to just go and get taken care of, and you don't have to worry about carrying $15, $20, $30 every single time you have to go to the doctor. Okay, and it requires insurance to cover childbirth as well as newborn infant care. Isn't that wonderful? These maternity benefits are a welcome breakthrough for young people. 2/3 of individual plans have traditionally excluded this type of coverage, which is very true, because I had a representative from an insurance company that will remain nameless told me that I had to purchase a whole separate plan just for prenatal, postnatal, and newborn care, infant care. And so with this law, they also cover pediatric care. Any child under 19 years of age will be able to get their teeth cleaned twice a year, as well as receive x-rays, fillings, and medically necessary orthodontia, which is great because I was one of those children. I had braces for 4 years, and well, my mom said it was covered by their insurance, but I know for those who don't have insurance and your child needs braces, boom, right there. In addition, children under 19 will be entitled to an eye exam and 1 pair of glasses or a set of contact lenses a year. Isn't that great? I think it's great. Relatively few health plans cover children's dental or vision services today. So this whole Affordable Care Act is pretty much for everybody. Everybody will benefit from it. It also covers rehabilitation and habilitative services, preventative and wellness services, laboratory services, ambulatory patient services, prescription drug services, emergency care, which to me was extremely important because there have been times where I have felt sick, my husband has felt sick, and you want to go to the emergency room? Like, hell nah, because they will look at you, give you 2 Tylenol, and you will get a bill in the mail for $2 grand. Not I. So, because of that fact, people avoid going to the emergency room, especially when it's not like a dire emergency, because they don't want to get a huge bill, you know, in 30 days. And so what this plan covers is you can go to the hospital emergency room with a sudden or serious condition, such as symptoms of a heart attack or stroke. The emergency visit is already covered under most plans. But under the reform law, emergency room visits do not require pre-authorization, and you cannot be charged extra for an out-of-network visit. Isn't that great? Also, plan covers mental health services for $40. You can go see a shrink. So you need some help, go see a shrink, $40. Ain't that great? Hospitalization. Under the law, your insurer must cover hospitalization, though you may have to pay 20% of the bill or more if you haven't reached your out-of-pocket limit. Some hospitals charge $2,000 a day for room and board alone and $20,000 with medical services, so those bills can soar. This year, medical costs will help bankrupt 650,000 American households, including many who thought they had decent insurance until diagnosed with a serious illness. And so you don't really know what's going to happen, what happens from day to day. You don't know what you may, you know, get sick or whatever, have to go to the hospital. You don't want to have to be stuck, you know, with the dilemma of, you know, do I stay in the hospital to get the care that I need, or do I go home and just die because I can't afford to stay in the hospital? So for those people who are running around crying and itching and moaning about the health care plan, now we'll talk about what everybody else is talking about, which are the penalties. Now, I gotta go find it. Let me go find the penalties. and I'll discuss the penalties so people don't be like, oh, you're just trying to say all the good stuff and you're going to skip all the bad stuff. Well, I don't think it's bad, but I just think it's more of an incentive to, you know, somebody's got to force you to get some damn insurance. They ain't got to force me, honey. Shoot. All right. Consumers will be charged a penalty if they are required to buy coverage but do not. The penalty in 2004 will be $95 per person, $47.50 per child, with a maximum of $285 per household, or 1% of family income, whichever is greater. Penalties will go up through 2016. However, some other groups will not be penalized if they do not buy insurance, including families whose income fall below the threshold of filing an income tax return, or about $10,000 a year for an individual, and members of an Indian tribe. You know, so that's pretty much it. But you could completely avoid it if you just sign up. And you have until this October the 15th. No, excuse me. Sorry. You have until October 1st to March of 2014 to sign up. So you have plenty of time to research, do what you need to do, find out what you need to know, so that you can go ahead and get your insurance, honey, because I've been without health insurance for so long, because at my previous job I had insurance, but I felt like it was bull because I paid more out of pocket than I did, than it was actually worth. I paid my premium. They took my premium out of my check every 2 weeks. I was only allowed to go to the doctor for a simple physical. Anything extra or above that, I would have to pay $75 plus to go to the doctor if I had an issue. And then that's not counting, they didn't cover emergency care at all. So if I had to go to the emergency room, that was my behind. That was it. I had to pay that. And so this new healthcare law is going to help people. The folks that are making such a big deal about it, especially in Congress, all those folks make an excess of $100,000 per year or more, plus perks, plus a lot of extra money that they get on the side. They can afford to go to the doctor without any insurance. They can, boom, write a check, take some money to the ATM, and boom, they got their health care. But for the average Joe, insurance, like my mother says, insurance was put in place for poor people and working class people who can't afford all these astronomical things like x-rays, sonograms, blood work. That stuff is expensive, especially when you have a mortgage and kids and rent and car insurance and all this other stuff to pay for. And there's nothing like talking down on anybody, not saying, but we do need health insurance, because the prices, unless you are independently rich and got a trust fund, it's high. It's really, really high. So if you want to learn more about, this healthcare law, you can go to healthlawanswers.org. Now, what the lady was telling us, the facilitator who was giving the workshop was telling us that because a lot of people are jumping on this healthcare, to sign up for healthcare so much during the day and during the normal day hours, the internet traffic is so heavy, they shut down the website. And so my advice to you is, when you want to sign up, or once you just, research and discover what is good for your family, your best bet is to try to access the site super early in the morning or super late at night, when, most folks have gone to bed or gone and done something else. So I urge you to check it out and do your own research. And because honey, when this thing gets enacted, I don't care. I'm going to the doctor all the time. If I get a pimple, I'm going to the doctor. If my ear itch, I'm going to the doctor. If my fart smells funny, I'll go to the doctor. I'm just going to go to the doctor, because let me tell you something. When you can't go, it's hard when you can't do something, when you just don't have the means to do it. It is extremely, extremely it's hard. It's debilitating. It's just like it's right there in arm's reach and you just can't grab it. So I'm going to take advantage of every single thing that they offer just to make sure my mind, body, and soul is good. You feel me? It's too many people dropping dead nowadays because of illnesses that if were caught early, they could have been treated and cured, and they could have gone on to live a happy and healthy long life. And so you can say what you want to say, government insurance is a handout, what the hell ever. I mean, y'all pay taxes, I pay taxes as well. They need to give us something. You feel me? So I'm cool with it. Now, I need to warn you guys, they did give us a sheet on scams. With any type of program, you got people out there who want to capitalize and be thieves and steal from people, and capitalize on people's misfortune or try to steal from people, So what you need to look out for are the healthcare scams. Law enforcement officials have already spotted scams like these. Scammers claiming that they were with the government, going door to door trying to sell fake insurance. If a person go to your house and knock on the door, don't even answer it. If you don't know them, if you ain't invite them, don't open the door. Telemarketers seeking personal information so they can send a new Medicare card or National Health Insurance card required by law, don't fall for it. Imposters telling customers they need to turn over personal or financial information to, or they would lose benefits or go to jail. Don't fall for the okie doke. Get their name, credentials, anything that you need, and try to look it up before you get scared and give them some stuff and you get got. Each of these pitches is a scam designed to trick you into losing money or steal your identity. But scam artists are slick, so it is hard to predict all the ways they are trying to twist the healthcare law for their own profit. Watch out for official communications. Government officials do not sell insurance policies door to door or over the phone. As new insurance benefits take effect, rely on trusted sources to tell you what you may need to know. Know who you are dealing with. If you receive a visit, call, or email from anyone claiming to want to help you sign up for the programs created by the healthcare law, they may not be who they say they are. Verify who is calling by asking for written information. Separately, check out who is sending you emails and don't open attachments from someone you don't know. Do not pay anyone to help you receive your new benefits. Do not reveal any of your personal information to anyone you do not know, such as your full name, date of birth, social security number, etc. If someone requests this information, it is more than likely they are out to get you than to help you. Where you can report scams. Law enforcement officials need you to report your concerns. The healthcare law includes extra resources for fighting healthcare fraud. Contact your state insurance commission, your state attorney general, or your local law enforcement about any suspicious promotions. Okay? So I will show you the paper, and you can, stop this video and it'll freeze frame for you so you can write this information down. Okay? I just have to rotate it so y'all can see. Oops, child please. So that is what it is in a nutshell. So you can go online, check it out, find out for yourself. But honey, I just can't wait to go and find out what's going on with me. And we're expecting some money in the next few weeks. So we'll just pay for a separate visit, when we get that extra cash, just to, find out what we can do in the meantime. And then in January, we'll definitely start going to see the doctor on a regular basis to get whatever help that we need and whatever services that we qualify for into getting our BFP. Alright? So if you have any questions, comments, or concerns, or whatever you want to say, you can put it down below. Alright? And I urge you, do your own research. Find out exactly what it is before you listen to these fools on television that all they care about are themselves. They don't care about nobody. Rich folks are rich and the poor are poor. Eventually, in the next 10 or 15 years, there will be no middle class if we let these rich wigs just take away everything that we as Americans are entitled to. Alright, so I will talk to y'all later. Peace and hair grease. Enjoy the rest of your week. I got homework to do. Bye. See you later.